AEDs are user-friendly devices that give step-by-step instructions by voice prompts that enable the user to correctly use the machine and save the life of someone in sudden cardiac arrest. Now, to understand how the AED works, it helps to understand how the heart works. I want you to think of the heart like it's a house, and it's got 4 rooms, electrical, and plumbing. Now, the heart will stop working for 2 reasons, either electrical or plumbing. And in the case of a heart attack, it's a plumbing issue because the blood flow has been blocked. When it comes to sudden cardiac arrest, that's an electrical problem. Problems with the electrical system can cause abnormal heart rhythms called arrhythmias. 2 of these arrhythmias are called VTAC and VFib. In both of the cases, the ventricle is not working properly. Now, the heart is still electrically active, but it's in a dysfunctional pattern that doesn't allow the heart to pump and circulate blood. People with these type of arrhythmias, an AED will come in handy because it will restore a normal heart rhythm. Now, just to let you know, FYI, the AED, like all defibrillators, are not designed to help somebody that's in a flatline pattern. The only way to have a positive clinical outcome from somebody in a flatline would be to have a combination of CPR and cardiac stimulation drugs. Now, although the AED is super friendly, there are some special considerations that you must address before you use it. Failure to take these special precautions can lead to shocks, burns, and/or explosions. Number 1, oxygen. Make sure that there is no oxygen at least 6 feet away. Remove any metal necklace, cut and remove any underwire bras. Cell phones must be within 6 feet away from the AED because this can interrupt any kind of analysis. And of course, we want the chest to be dry from any water or sweat. Medication patches. A lot of medication patches have aluminum inside of them, which is a great conductor of heat, thus causing burns. So you want to make sure that you remove the medication patch, clean the area, and make sure that you're not cleaning it with any kind of wipe or alcohol prep that has alcohol based in it because that is very flammable. So we'll take off the patch, clean the area, dry it, and then put on the electropad. Also, when it comes to somebody with a pacemaker or defibrillator, you want to make sure that you put the electropad below those areas because we don't want the charge to go to the pacemaker or defibrillator. We want it to go to the heart. And lastly, a hairy chest. You want to make sure that the electropad comes in complete contact with the skin. So you want to go ahead and give a quick dry shave, and we're only concerned with the areas where the electropads are going to go, and then put the electropad. Now, the AED is super easy, and it has only 4 universal steps. The same steps would operate any AED. Turn it on, apply the electropads, and follow the prompts. It'll prompt you and it'll tell you what's happening. It'll analyze the rhythm of the heart, and it'll let you know if you have to do CPR or you need to push the shock button. Make sure that you leave the electropads on and follow the prompts. It's okay to go ahead and leave the electropads on and do CPR. You will not get shocked. Just to let you know that the shocks are anywhere between 120 and 200 joules. And also, many of the AEDs have event memories that will let you know how many shocks were delivered during that situation. And of course, stay with the victim until 911 arrives. Device maintenance. In general, the AEDs require very little maintenance, but just make sure that you follow the manufacturer's instructions. These machines are very smart. They do a self-check every 24 hours, and as long as the readiness to use button is flashing, you're okay. Just make sure you also check the expiration date of the adult cartridges, and those are always one-time use only. And then go through your checklist to make sure that you have everything.